Mental health matters. It is one of the most single-handed important things. Untreated mental health conditions increase your risk for heart attacks, strokes. There's something called adverse childhood events. The more adverse childhood events you have, the higher risk you are for cancer or heart disease. If we treat your mental health, maybe you wouldn't be on 50 medications and 3 blood pressure medications. Hi, I'm Heather Hughes. I'm a dual certified nurse practitioner and I own Optimum Health and Wellness. We are located in the Tampa area. We are a private practice mental health clinic, integrating functional health, hormones, gut health, and a multitude of other modalities to help mental health. I help people feel their best on the inside and out. I feel like I've always wanted to help people. I've always believed in, helping other people. I think through my own health journey and struggles, it really, has pushed me to want to help other people. And then I think like growing up, a young age and having my father with schizophrenia, I really was exposed to mental health very early on and always kind of worked in some capacity since I was very young in mental health. I think I've always really been interested, and I think just seeing some people feeling like they're stuck in a revolving door, a number, a statistic, and I just really wanted to do better for people. I think we are in like a wellness movement of wanting different options, wanting to integrate more complementary treatments, more holistic care, and I really wanted to provide that. I think I started taking my dad to the VA when I was 16 and like driving him to the VA hospital for his mental health treatments. And I feel like sometimes people would treat him differently for how he was, even though he's highly intelligent. He scored the second highest ever on like entrance exams for college. And just kind of seeing that disconnection, with how people maybe would treat him versus who he was to me. So I think the biggest thing is advocating for people, treating everyone with dignity, and meeting them where they are in their care. I really think, again, it's meeting people where they are. There's a million things that I could want to do for someone, but they may not be open to that. So I think it's more so about knowing your options and feeling empowered and educated and knowing, your mental health so much more than just a pill, a prescription, which we do give. And, I think with mental health being stigmatized, a lot of people wait until they do need that medication. They can't function. They can't get out of the hole. But I wish more people knew that you don't have to wait until you can't function and that we do comprehensive labs. We do lens neurofeedback. There's a ton of options that are a little bit more holistic, and you don't have to wait until you can't function to reach out for help. So I hope to bridge that gap in the community. When you're just getting by, you can do the bare minimum. You have to work, you have to take care of your kids, but beyond that, you're not able to do anything. Your quality of life's pretty poor. And so feeling optimized, it's that you have energy, you have motivation, you have social connections, you have good boundaries. I think more importantly, no, it's also self-loving. So you're able to set forth time to rest, time to socialize and be present and do things in the community or activities with your children, or feel that you have the mental capacity to put forth more effort into your work. I think it's so many different um, parts of life, and it's all comprehensive. Yeah, so I'm dual certified in primary care and psychiatry. And, I've worked in the emergency departments. I've seen things from the acute side. I've seen the primary side, like checkup or managing all chronic conditions. And then now mental health, which obviously ties into whole person care. Our routines and the way that we approach things really can affect, our moods as well. And so I think it's more so looking at the whole person. Some people have 5 specialists and they're on 30 medications, and it can complicate things a little bit. So I really think it's looking at the whole person. I do comprehensive labs. I try to get medical records for everything that I can. And, I tell patients you're like a jigsaw puzzle and, not just any piece fits in that puzzle. we have to find the right pieces. So it's finding someone who really listens to you, makes you feel seen and heard, and is going to advocate for you and make recommendations that can truly help you get better outside of even just medication management. But I think there's so many things that we can do for our mental health, even as simple as just keeping a routine that can really transform us and how, we feel. So I think sometimes it's so, you don't feel well enough to want to really too much. So medication, obviously, when you're unable to function, but it's also trying to look at other things and getting to the root cause and taking medication, and then we can get to the root cause of other, potential contributors, and then try to reverse out that way. And it's about having a full treatment plan that's very personalized and knowing you have options. Some of those options are self-pay. We do accept most insurances. We try to make it as affordable as possible, but some of those options are self-pay. And so a lot of people doing like complementary care typically get the best outcomes because, it's different modalities for treatment. Seeing a lot of patients, short appointment times, feeling pressure myself as a provider, let alone as a patient with so many questions and no other options besides, therapy or medication. So I really feel that there's a way for providers to not feel so much pressure and to be able to deliver exceptional care, and for patients to get really great care and get many options, have discussions, have access to healthcare, time to discuss their problems, and not feel like a number or a statistic in a revolving door. A lot of times we're reactive and it's not proactive. And I know for myself, like, doing all of the different health testing and markers and Dutch tests and GI maps and all the things that I've done to get well or work towards wellness, it's just not traditional, right? And a lot of times we're not taught those things in school, and the general population doesn't know what their options truly are. And things have changed so much, and they're continuing to change. And again, like, we're on this whole wellness push in the community. And I think it's wonderful because I really do think it gives you so many more options. I think it's more comprehensive. I think it offers a lot more options. I think it offers more holistic options. I think that we look more so at the entire person and really try to use medication, therapy, and other complementary treatments so that people get the best outcomes. I mean, we really do see amazing things. Those people who really are searching, they haven't found what works. They're restoring their gut health. Maybe they're taking some medications, they're doing neurofeedback, they're taking supplementation. They do exceptional. And when you can give someone their life back, especially someone that's been depressed a long time, there's no feeling like that. To have compassion, to not make people feel dismissed or overlooked, and, to really want to advocate for people. I think it's unnerving sometimes. It can be a little overwhelming, a little scary, but when you get there, you'll probably feel pretty safe. And, I think the initial offset of the vulnerability is a little hard, but you'll feel safe. And I think when someone leaves my office, they feel like I really know them. Not like the surface level of them, but really their core, who they are, their vulnerabilities, the things they're struggling with. And I think they'll feel heard. I think it's taking time and, getting a thorough history, asking the right questions, creating an environment, and then allowing for people to reflect. And if they have follow up, they can reach out. We use the phone system, and they can text in the phone system. So if they have questions or need follow up, they can always reach out. And I think having that access really helps because maybe something was missed, or something has changed and they just kind of want to reach out. So I think that helps a lot too. You know your body. You live in your body. You are your best advocate. And it's just about not giving up hope, looking for alternative resources, and finding someone that will listen to you and make you feel heard. My big mission with my practice is just having a huge holistic and functional wellness space, really dedicated to overall wellness and health. That they felt safe, that they felt heard, they don't feel like a number, that they know we remember the small details. And I hope that we give them hope.